But if many people go to the doctor, the medical expenses, of course, and labor costs are, of course, really high. Now, moving on to my mechanisms. Medical equipment is really expensive to buy and use, and if they don't really pay a bit of part of their medical expenses, the country's economy will not be good anymore. Now, moving on to my second argument. People do not cherish. If the people don't bear part of their cost, they won't cherish such a good medical fantasies and things. And now I'll take a POI.
Okay, so how would you address the problem that how would you address the problem that the poor will face significant financial burdens if they need to pay for the healthcare system, which should be universal to everyone?
Can you say it again, pardon?
Okay, so how would you address the problem that the poor will face significant financial burdens if they need to pay for the healthcare system, which should be universal to everyone?
Sorry, I don't understand, and I'm gonna go back to my argument. Because of the now moving on to my mechanisms, because medical fantasies and free are the medical treatment industry, they will not share with it. Let alone see the efforts of doctors, nurses, and medical staff. And because of the reasons I mentioned earlier, even it is like a really small and minor sickness, it is clear that you can recover by drinking more water or only drinking a small medicine at home, but you still have to go to the hospital because you need the free treatment. Thank you for listening to my speech. And I am pro, and we are proud to oppose that. In countries with free healthcare, we believe that people who make poor lifestyle choices should have the pay upfront to cost their own health care. Thank you.
Our stance is we believe that making individuals pay for healthcare based on their lifestyle choices is unfair and counterproductive. Healthcare should be a universal right, not a privilege influenced by personal behavior. And penalizing people for their lifestyle choices creates discrimination and exacerbates social inequalities and undermines the fundamental principles of free healthcare. Our burden is on the opposition is to prove that making individuals who engage in poor lifestyle choices contribute to their healthcare costs is unfair and detrimental to the healthcare system. Our framing is healthcare should be a universal right and not linked to one's lifestyle choices. Penalizing individuals for their lifestyle choices can lead to discrimination and social inequalities. Our argument is it adds to the burden of people and have many contributing factors. It is challenging to direct link and specific health problems to individual lifestyle choices. Many factors contribute to health, including genetics, environment, and access to healthy options. Health is influenced by a multitude of factors, and it is oversimplistic and unfair to attribute health issues solely to lifestyle choices. Penalizing individuals for lifestyle choices could hugely affect lower income groups who may have fewer resources for healthy living, and tracking and verifying lifestyle choices for cost adjustments would be complex and expensive for healthcare systems. Penalizing individuals for poor lifestyle choices by requiring them to pay for part of their healthcare costs could exacerbate healthcare disparities and perpetuate inequality within society. And factors such as income, education, access to healthcare services, and social determinants of healthcare significantly influence individuals' ability to make healthy choices, imposing financial penalties on individuals who may already face many social and economic barriers to healthcare access could further marginalize vulnerable populations and deepen existing health inequities, and healthcare should be fundamental human rights, and denying individuals care based on their lifestyle choices contradicts the principle of universal access to essential services. Our impact is in a free healthcare community. The fundamental goal is to provide equal access to medical care for all citizens, regardless for their social or economic status, and imposing financial penalties on individuals for their lifestyle choices undermines this principle. Such a system could create a divisive atmosphere with those who fall ill due to poor choices are viewed as responsible for their misfortune and rather than as vulnerable members of society who require support. And because of that, I am proud to propose.
Now, I'm probably to oppose I'm probably to oppose that proposed idea because at first I'm going to rebut my opponent's argument. My opponents say about the expensive and fair for each people, but you talk about expensive money and some people can afford it. Actually, this is completely unfair for these people who like they build these hospitals and these kind of things too because they buy many expensive machines and these kind of machines all cost many money just as our first speaker Alyssa said about the economic things. And now I'm going to talk about my argument. My argument is about the pressure for the workers in the hospital. Now move on to my first mechanism. The first mechanism is that people think it's cheap to go there, and every day for small diseases they go there again and again, and this makes them go to the hospital many times and make the workers make the workers need to work a long time. So that, for example, you only have a little cost and you can cure it by just drinking a little bit of warm water or some cough syrup, but you just go to the hospital and make the nurses at the doctors to cure it for you. But this is completely unfair for that because they shouldn't work for these small disease. They should work with big disease. And the second mechanism is that the workers will be so busy that they can cure the people who really have big diseases and such as you have a cost and you go to the hospital and tell the doctor to heal it for you, but they're at the next minute, people who have a big accident came, and the doctors because they are dealing with using. Okay, I accept your PI.
Okay, so how would switching the responsibility to hospitals solve the problem about like the gap between the rich and the poor and their like accessibility to healthcare?
Can you say that again?
So how would switching the responsibility to hospital solve the problem about the gap between the poor and the rich and also the accessibility to healthcare?
Actually, this can make like the poor people who are they can't afford this, they can't feel hospital. But some rich people, they don't have their body very good, and they can't go. They we need to let them to get money. So to move back to my argument, I'm going to talk about my APAC. My APAC is about that first that workers will be so tired that they won't work anymore because they are so tired. And the second impact is that big disease people can get cured on time and maybe this will cause bigger diseases. And the third impact is that it will waste a lot of resources because every time you come, they need to test your blood and other things which waste a lot of resources. So judge, do you really want to disagree this title at the risk of losing some people's life? Like making some people's disease become worse and wasting a lot of wasting a lot of resources that is but from money. And making the workers so tired they don't want to work, and the hospital will collapse. Do you really want this result? If you want, you can just vote for them and don't vote for us.
I'll be rebutting my opponents and offering our side's second contention. So, firstly, they said something about having a national burden. Judge, we have several responses to this. Firstly, fairness in healthcare should be based on providing equal access to care, not on penalizing individuals for their lifestyle choices. Like what our first speaker has said, health is influenced by a range of factors, including genetics and environment. So it is unfair to single out individuals for circumstances often beyond their control. Our second response is that the fundamental goal is to provide equal access to medical care for all citizens, regardless their social and economic status. Imposing financial penalties on individuals for their lifestyle choices undermines this principle. Such a system could create a divisive atmosphere where those who fell ill due to poor choices are viewed as responsible for their own misfortune rather than a vulnerable member of society who requires support. Our third response is also financial burdens could be solved by raising funds by the society, which is contributed by everyone, lessening the burden on some people, especially the poor who don't have like any choice over like circumstances. Our second response to their argument is they said that it encourages personal responsibility and healthier behaviors. Judge, we have three responses to this. Firstly, penalizing individuals based on lifestyle choices can discourage them from seeking medical care out of fear of financial repercussion, which leads to worse health outcomes. Do you really want that? Of course not. Second, health is influenced by a multitude of factors, like we said before. And thirdly, imposing financial penalties on individuals who may already face socioeconomic barriers to healthcare access could further marginalize vulnerable populations and deepen existing health inequalities. Healthcare should be a fundamental human right, and denying the individual's care based on their lifestyle choices contradicts this principle of universal access to essential services. Now, moving on to our team's second contention, which is about alternative approaches. So, firstly, I don't accept. Firstly, we talk about health promotion. So, firstly, promoting healthy behaviors during public awareness campaigns and making healthy choices accessible can benefit everyone. This could include subsidizing healthy food options, encouraging physical activity, and allowing smoking cessation programs. And this is like the approach that my opponent said is ineffective because it is deterring individuals from seeking necessary medical care and exacerbating health conditions. As we said before, fear of financial penalties associated with lifestyle behaviors could discourage individuals from seeking preventive care, early intervention or treatment for chronic conditions, leading to poorer health outcomes and increased healthcare costs in the long run. Healthcare should prioritize prevention, education, and support for individuals to make positive lifestyle changes rather than punitive measures that may hinder access to care and exacerbate health disparities. Healthcare is not merely a financial transaction of a free healthcare system. Therefore, our side is clearly rebutted all of their arguments and supported our side with both alternative and also supporting why it is so ineffective. Therefore, we're so opposed. Thank you.
First, our rebuttal and rebuild our ideas. First, they said that it is unfair for people who are poor, but people who are poor do not work hard. They actually are not poor when they're born. They are not disabled, or they don't have some diseases that cannot do something. They are poor because they don't want someone who has lots of money can use their brains, and they actually worked hard when they're small. But people who are poor do not work when they're young. They are poor because they don't want to work hard. They are poor because they don't have they didn't graduate from a good university. So, Judge, I think we won this debate by going to three main questions. The first question is, if healthcare is too cheap, other people will think that it is not cherished. People will try to go to the hospital as much as he or she can. They will go to the hospital when they are not don't need to. For example, when they caught a cold and were sneezing frequently, they might think that, oh, I am terminally ill and I need to go to the hospital because she will or he will know that this is very cheap and won't cost a lot of money. This will make other people who are really ill can't get treated at the best time. This sometimes will make people even iller and have other health problems or even get disabled. So my first question is, what will you do if everyone is going to the hospital frequently when they don't need to? Now move on to my second question. My second question is, if too much people go to the hospital and the hospital don't have lots of people to take care of him, what would the person who really got ill do? The doctors need to take care of the people who got there first, but there's too much people because all people are running to the hospital and saying, oh, it doesn't cost so much, and I can go
POI.
now I'll accept the PR.
Okay, so how was switching the problem to like hospitals actually solve the problem?
What do you mean?
Like how was switching the like responsibility to hospitals solve the problem of the poor people?
We didn't say switch the problem. We said that the country don't need to give people who are poor give them money. Now continue my second question. The doctors need to take care of people who have got there first, but there's too much people who are not ill go to the hospital. This will make other people wait a long time and even get a deeper disease. My third question is, if too much people go to the hospital, it may make people feel tired, make the doctors feel tired, and go to strike. Hospital strike will make people who had illness feel even worse. So today, I still stand on the poor side, saying that poor people still need to pay the healthcare. Thank you.
In this speech, I'm going to give rebuilding based on what our opponent have rebutted us by, and also like I would prefer verbal POI. So, they said they actually told us in their second speaker told us by rebutting. They rebutted us by saying that like actually, the hospitals takes up the responsibility and that those hospitals they pay a lot for those expensive things. However, we actually say that even if the hospital pays for a lot of like expensive things, they can earn that back by treating the patients. So actually the patients have to pay money for going to the hospital. It isn't free. And notice that judge they keep talking about the hospitals, and that's not entirely relevant with this topic. So also they said that the rich people may want to fake that they're really unhealthy. However, judge, we have a response to this. So actually, it is part of the company's obligation to investigate these things. So if we have an investigation, so it is actually one of the insurance company's goals. So we actually apply the same logic in this way. So if the people go actually to the hospital, whether if they are unhealthy or healthy, so the companies will have to do an investigation to find out about those things. So that is completely not going to stand. So actually that is not true. So judge, we actually tell you that what they have said is not true, and that this hospital is not the main thing that we should focus on. And so now I'm going to rebuild some of our cases now. So in our case, we have mainly talked about how actually that we think that the individuals pay for the healthcare based on their lifestyle choices, and it's really unfair for people. So as our first argument goes, we say that it can add to the burden of the people. So actually, it's really challenging to have these specific health problems to individuals' lifestyle choices. So we actually tell you there's a lot of factors that add to this. For example, environment and access to the healthy options. So actually, as we have already said it in the impact here, we actually told you that as a like the rich will get richer and the poor will also get poor, and as this goes on, this will create a really bad cycle, and that is not really what our side had wanted to see. And our opponent didn't really successfully prove how their side can maximize the utility and the happiness of the people as their framework goes. So actually what they have said does not stand. So these people, like poor people, if we actually let them pay for these things, they cannot actually afford this, and that actually they don't have the money to afford a healthy lifestyle and these things, so it is not achievable for them to do a lot of like these things. So actually what they have said is not true in this scenario. So for all these reasons above, due to what we have rebutted them by and rebuilding our own case and rebutted based on what our opponent had actually rebutted, spice, and also how in our case we have successfully proven that the burden of the people will be maximized if we actually let them pay the costs of their healthcare. Judge, you should have a clear con ballot. Thank you.
I'll go to their case and our case and so wait for their case. They said something about national burden. We rebutted that by saying financial burden can be solved by raising funds by the society, which is contributed to by everyone, lessening the burden on some people, especially the poor. The second contention is about responsibility. We have responded to this by saying analyzing individuals based on like lifestyle choices can discourage them from seeking medical care out of fear of financial repercussions, which can lead to worse health outcomes and higher costs in the long run. And they have never explained to us why switching the responsibility to hospitals can solve the problem between the gap of the rich and the poor. Therefore, all of their arguments does not stand, and they have never rebutted that. Now, in our case, we have two very simple contentions in this debate. Firstly, it adds to the burden of people and have many contributing factors. And second, it has a lot of effective alternatives. Well, I've told you that firstly, it is challenging to directly link specific health problems to individual lifestyle choices. Many factors contribute to health, including genetics, environment, and access to healthy options. And secondly, healthcare should be a fundamental human right, and denying individuals care based on their lifestyle choices contradicts the principle of universal access to essential services. And thirdly, factors such as income, education, and access to healthcare services and social determinants of health significantly influence the individual's ability to make healthy choices. Judge had no adequate response to any of these arguments. Recognize that even if you give them every single argument, we still win this debate because our case outweighs theirs. The best case scenario is like people get to pay for their own responsibility, and that the hospital will be like tiring in our case, but at what cost? People might actually die because of the denial, especially when they're poor, and they're like there are a lot of more factors that that is challenging to directly link specific health problems. Therefore, our impacts clearly outweighs theirs. For all these reasons, we're so proud to oppose. Thank you.
So, Judge, unless I'm still standing firmly on the pro side, I believe that you should vote for us. First, I'm going to say all my opponents says, which is first my opponents said about the responsibility to the poor people, but actually we have already explained it because the title already explained it, because the title said that the country was free healthcare. This means that if you go to the hospital and you don't have your poor lifestyle, this is free. So that we have this title have already explained it for it, because the poor people, they can't go to the healthcare for free. So the title already explained that we are not going to enslave every poor anymore. And you are talking about they will be not free. You also talk about which is they go to health care, and this health care is actually not free. But at this point, you actually misunderstand this title, because this title already said it's free health care, but you're still saying about like they are a bit not free, and actually they need to get them money so they can go to the health care. Now I'm going to say that our response is that for your sake, our response is that if they have free healthcare and they even don't get money from these people who make their life poor, and we even don't get money from them, then where does money we come to buy these kind of machines? Actually, we get this money from these for style choices people can only make these machines better, and it can give these poor people better services. So actually, our side of argument is more necessary than yours because I think you're completely misunderstanding this title by misunderstanding this healthcare can be not very actually it's not very free. So at last I said that probably on the pro side. I'm probably said that this emotion is